It's my feel-good breakfast show.
Yeah, you guessed correctly. It's still health advice. You're still locked in. It's still your feel-good breakfast show. And we are continuing our health conversation and discussion this morning with infectious disease specialist Dr. Emil Reid. And he's still with us and ready to answer all of your questions on the coronavirus vaccine. And a big thank you once again to everybody and each and every individual who has sent through their questions. And I've just chatted to Dr. Emil Reid, and he has mentioned that after the show, if you guys have any questions that you'd like to pose, you're more than welcome to also put them on our Facebook page, and he'll go on later and try answer a few of those questions too. So if you don't get around to you in the session now, you're more than welcome to head over to Facebook. So we've got another call on the line, Kukle.
Yes, we've been calling out to you to call in on the show to ask Dr. Emil Reid any questions that you might have regarding the vaccine. And right now we have Lynn all the way from Durban. Good morning to you, Lynn. What's your question for the good doctor?
Good morning. Thank you for taking my call. I'm interested to know people who have recovered from COVID-19, will they still need being vaccinated?
Lynn, that is a fantastic question.
Yeah.
Some good questions coming through this morning.
Amazing
Loving
questions.
It, yeah.
And I think the bottom line is, and also what has been shown from the AstraZeneca trial and also from the Novavax trial, is that the people that were included in the study, some of them already had antibodies, which meant that they had COVID before. And with the new variant that is currently circulating, we found that there is not merely enough antibodies to protect them against the new variant in any way. Meaning that people like Lynn and myself who have recovered of COVID disease should definitely get a jab in order to also protect us against the new variants circulating. Because our antibodies that have been induced by the previous infection might not be enough to protect us.
Sure. All right, well, Doc, I mean, we're speaking about it all morning. We're speaking about the vaccines, and now we're talking about the new potential vaccine coming through, which is the one from Johnson & Johnson. So my question really is, what is the difference between the Johnson & Johnson vaccine and the Oxford Zeneca vaccine that we're speaking about, number one? And is it more effective? Is it what is needed for our specific coronavirus development that's occurred in our country? I mean, what's your take on that?
Well, the first thing we need to remember is that both of them uses the same foundation for the vaccine to be developed. Both of them are vectored by adenovirus, a chimpanzee adenovirus, and hence the reason for us to not understand the efficacy of the AstraZeneca and the Johnson & Johnson. What is different, though, is that the Johnson & Johnson vaccine was trialed much later than the AstraZeneca vaccine. And also in Brazil, in America, and also in the UK, and in South Africa particularly, it was found to be 60% efficacious against mild to moderate disease, and around about 85% efficacious with regards to severe COVID disease, hospitalization, and death. What is also nice about the Johnson & Johnson vaccine is in the UK, they actually followed patients up for a few months after they got the jab. And what they found was that after 49 days, 100% of people were protected against severe disease of COVID and also hospitalization, meaning that this vaccine actually gets better with time.
Doctor.
Would that apply to mild and moderate as well, or is it just increasing more predominantly in the more infectious block of that?
Well, in the UK, for instance, mild to moderate infections was around about 85% efficacious.
Oh, wow. Okay.
But take note, that was before the new variant came along.
Oh, okay.
And with the presence of the variants, it actually took it down to around about 60%. But the important thing for us is to recalibrate our minds and understand that we're not going to have herd immunity anytime soon. We're not going to eradicate COVID soon. But the one thing we need to focus on is to protect people from becoming sick, going to hospitals and overwhelming the hospital facilities. Hence the reason for us to focus on what do we need in order to protect people from becoming very, very ill. So the mild to moderate, not going to have a big impact because those people will be at home, although they will still transmit the virus. But those people going to the healthcare facilities, that should be our priority before the next surge of COVID-19 comes.
I mean, there's another option that we get into it, perhaps in your next visit, the Sputnik 5 from Russia, that vaccine particularly. But I want to focus on the Johnson & Johnson. When do you think roughly the timeline that our healthcare workers will receive the Johnson & Johnson vaccine?
Well, currently we're going through a lull with regards to COVID cases. So now is a perfect time to actually vaccinate healthcare providers. We did hear from the Minister of Health that we're expecting the first batch to arrive during the course of this week, and that will be around about only 80,000 dosages. And also another difference that I forgot about before is that the AstraZeneca jab is 2 jabs taken 3 to 4 weeks apart, whereas the Johnson & Johnson is only a single jab. You know, amazing. So we're looking forward to these vaccines arriving, and we're actually looking forward to more and more dosages coming through to South Africa.
Well, Dr. Emil Reid, it's always a pleasure having you in the studio. Thank you for answering ours and Mzansi's questions. And of course, guys, don't forget that you can still ask us a few questions on our social media pages, and you can head over to Facebook for that. And Dr. Emil Reid will try his very best to answer as many questions as he can. So don't forget, your questions will still be answered. Dr. Reid, thank you so much.
Pleasure, guys.